Hello, everyone. Welcome to On the Front Lines. Today we have Sohini Bhattacharya joining us. Before Rishabh sets the context for today's discussion, a few housekeeping notes. We are live on Facebook, YouTube, Twitter, and Twitch. We encourage all our attendees to feel free to share their questions on the comments for each of those platforms. And our team is monitoring those quite closely, and we'll be directing those towards Sohini so that we can get her thoughts on them. Rishabh, over to you.
Thank you, Sohini, for joining us.
Thank you for having me on this show and giving me the opportunity to talk about something very close to my heart and my work.
We're very happy to have you here. So, Sohini, over the last few weeks, we've heard various sort of distressed notes from across the country from all kinds of populations, whether it's migrant workers, whether it's children, whether it's transgenders, and obviously women also. And one of the things we've heard is that the rate of domestic violence in India has almost doubled. And the National Commission for Women actually wrote out an email to this effect. Before we go to that end, could you tell our audience, what does domestic violence mean? Because in popular culture, it is pretty much physical violence. But what does domestic violence really mean for women in India?
Domestic violence actually means not just physical violence, though that is only the most common form of violence associated with it. Any kind of psychological, emotional, verbal, and physical violence and sexual violence are actually come under domestic violence.
And on a non-pandemic or in a non-pandemic era, what does domestic violence look like? Let me explain this a little further.
Right.
What would be the natural state of domestic violence? What kind of statistics do we see then?
So for years, activists have actually maintained that intimate partner violence, and which is a larger umbrella violence, is actually a pandemic, because it affects 1 in 3 women across the world. The current pandemic has brought focus to this crisis once again, but it's a public health and a human rights crisis of mammoth proportions. In India, very recently, actually, we've had the National Crime Research Bureau, NCRB, come up with some data in conjunction with the National Family Health Survey of 2015-16, which highlighted that 30% of women in India between the ages of 15 to 49 have experienced physical violence. Reports suggest that married women experiencing physical, sexual, or emotional abuse, an alarming 83% list their husbands as main perpetrators, followed by abuse from their husbands' families, parents, and siblings. So, according to NCRB and the latest crime report of India 2018, a crime is recorded against women in India every 1.7 minutes, and a woman is subjected to domestic violence every 4.4 minutes. In 2018, there were 89,000 plus cases related to crimes against women, as opposed to maybe 86,000 cases registered in 2017. And a Thomson Reuters Foundation survey in, I think, 2015 had actually said India is one of the worst places for women to actually live in terms of where violence against women is concerned. And also, these statistics actually do not capture the data on violence against women in this country entirely, because due to the prevalence of very patriarchal social norms, which are very orthodox and traditional, there is an enormous amount of stigma that is placed on survivors of domestic sexual violence. So that results in cases being grossly underreported. Women feel that they should be going to police with these cases, because if they go and complain, the abusers, once they're released, then the harassment can go up. The violence can increase, and the violence can come from the from the husband's family as well. Also, there is an inherent, mistrust of the system, because police also comes from the same patriarchal conditioning that the rest of us come from. So this was already a pandemic, regarded as such. And so this pandemic has actually brought it out that how disproportionately women and girls can actually get affected by this kind of a pandemic.
So, and now it's important to know that if things were already so bad,
Right.
What's happening now?
Yeah. So, we initially, when we just started kind of focusing on this, I think end of March, when we decided that during the COVID-19, we will have to look at this. See, there is uncertainty everywhere, right? People are worried about their jobs, their future. There are pressure cooker environments being built at home. Arguments and conflicts, even among peaceful relationships, are being reported, So imagine living with an abuser in a lockdown situation. Even in normal times, domestic violence survivors find it really hard to put up with their abusive relationships. But at a time like this, living in isolation, under lockdown, their mobility is restricted. There's no respite or options of going out, meeting other people, or going out to work for certain kind of women, or going out to the market with their products and things to sell for other women. It is difficult, when they are not going to find any outlet at all. And then, you're 24/7 in a closed confinement with the abuser. So you are not even able to make a phone call at times. Initial stages, in the initial weeks, many hotlines, and including the NCW, reported a less number of calls coming through. There's a sudden drop in calls because women were not able to call out. They were not getting access to a phone, or they were, with the abuser in close confinement, they didn't have the time or the privacy to make that call. And then suddenly, on 2nd April, NCW reported the number of calls have doubled, and many of them were coming in as SMSs, messages, emails. So continued stress, tension, uncertainty, frayed nerves, flying tempers, escalating the conflict situations, And the lockdowns have also abused, have also isolated the most, vulnerable people from the service providers that could help them as well. So that's one part of the thing. Women whose livelihoods have been affected by the crisis, who are, who do not have a job anymore. There are people like that who are in financial distress. This is one of the barriers to removing themselves from a violent household. You cannot just now walk out, So also women who might have been saving up money to leave might now have to utilize those savings elsewhere. Yeah. On top of that, there is also an increase in household chores. And children are back from home, homeschooling is happening. If you still have a job, then you have to also dedicate some time towards that. If there's elder care, if there's cooking, if there's home, other kinds of household chores to be done. And, if there is somebody in quarantine, looking after even that person, women were doing 3 times more unpaid care work than men, even before the conflict. So even before the pandemic. So with this, all of that is creating an unprecedented burden on women. So being trapped in a space with a violent or a manipulative individual has far-reaching repercussions. There could be physical, sexual, and threats, psychological abuse, humiliation, intimidation, controlling behavior, the ability to actually restrict a person from her family, her friends, monitor their movements, monitor their spending, restrict access to financial resources or employment opportunities. All of these behaviors, which falls under domestic violence, could have lasting effects on people and significantly affect mental health and well-being. So that's what has happened over the last, I think 4 weeks into the national lockdown, and 2 more weeks or 5 weeks, right?
Yeah.
And 1 more week to go. More than a week, I think 1 more week to go. So that's what we've been hearing. The number of cases reported might not be proportional to the actual rise in domestic violence also. Again, because people are not getting access to mobile phone, or they do not have the space or time to call for help. And where they kind of look at physically removing themselves from their situations, those are also not possible now with the lockdown. We had organized at Breakthrough, we had organized a town hall on April 20th. There were 300 participants from across the nation. There was also the chairperson of National Commission for Women. And we heard there, stories of what people are doing in this situation, how somebody from Northeast Network in Assam, Guwahati, had to travel, kilometers to actually rescue a mother and her 5-year-old child from an abusive relationship. And then we heard stories about how shelter homes are not accepting women because, this is a quarantine situation. So, yes, generally horror stories from across all over.
So, Sohini, in such a restrictive environment, where traditionally tools such as police personnel or helplines, they become less effective, what are the support mechanisms that are actually available to folks who are suffering?
Right. So there are helplines. There are government helplines, national helplines. 181 is a number that you can dial and reach. 1090 is another number. And there are then NGOs and other nonprofits who run helpline, counseling centers, drop-in centers. So drop-in centers are out of question now because you are not allowed to kind of even travel out. The tragic thing is that access to interventions or law enforcement, like dialing 100 number, is also severely restricted because police is actually involved in other crises that they are dealing with this pandemic. So their response to such reports and their SOS, which is generally sometimes attended to, are also either being ignored or delayed. So even though reports are pouring in, responses at this point are very sporadic at best. And in some worst case scenarios, they may be too late. So when there is a response, service providers are also finding difficult to reach the location, So even if they make it through safely, their lack of protective gears, there could be safe transport. The lack of safe transport can, add to these problems. So the thing is that as a national response, the problem of domestic violence has been, what should I say, ignored for such a long time, that factoring in this issue during the pandemic or thinking through early responses to the crisis and the lockdown is, I think, almost too much to expect the government to do at this point of time. 181 is a national hotline, as I said, but again, we have heard stories from, our project sites in other states that in many places 181s do not have the adequate resources. They do not have the number of cards. They do not have the number of personnel even. They haven't been able to pay salaries for many months. So the whole response mechanism on domestic violence, which has clearly provisioned for in the amended law in 2005, has many, many features. But almost 50% of those features, or even more, I'm making a conservative assessment, are not in place. So when you have an infrastructure which is already shaky and already not geared up to respond to the existing crisis, in a pandemic, that infrastructure is almost crippled to respond to something like this. Of course, a lot of NGOs and a lot of national helplines, a lot of local helplines are actually supporting women. They're doing their best. But the lockdown is such a situation that getting somebody out of an abusive relationship or going there to see what is happening is being restricted in many places. So the law can actually, for example, the law actually says that you can move the perpetrator from the scene. The Pune Zile Parishad recently had decided to send the men who were, they got calls on domestic violence, men who were abusing. They decided to send the men to institutional quarantine centers run by the district administration. Now, that is something everybody's saying, oh, how innovative this is and how fabulous this is. But this is not innovation. This is actually under the law, under the domestic violence law. The law enforcement officers can actually remove the perpetrator, so that the mother, and if there's a child, so that the wife, and if there's a child, they can actually safely stay in the house. It's part of the provision. But nobody has really done it before. And so when the Punna Zile Parishad did it, it was like, really, wow, wonderful. This is such a fantastic move. It's a revelation, yeah. But they've been very good at it. Even the state home minister, Anil Deshmukh, had taken to Twitter and warned that the police are keeping a close watch on such incidents and will take serious action. And that helps, that kind of an officiousness about this. If people know that somebody is watching and that you might be getting penalized for that, it will not remove your behavior, but it will put the fear in you, so you will think twice before you even do something like that. So, when governments start putting together plans to respond to a crisis like a COVID-19, addressing domestic violence should have been prioritized. But it has not been formally integrated, because domestic violence and mental health repercussions are not part of the public health preparedness. Has never been part of the public health discourse. But domestic violence is actually public health hazard. It has many incidents, including, post-traumatic disorder, many other diseases actually associated with domestic violence. So that's why they are not part of the emergency response plans against the pandemic. Unfortunately, women and girls have experienced increased risk of various forms of violence during previous epidemics too. So there's enough evidence from a Ebola outbreak, which happened in DRC, Democratic Republic of Congo. There is enough evidence from Zika, which happened in Africa also, that particularly sexual violence, domestic violence, sexual exploitation and abuse go up significantly during epidemics. And there activists and researchers, people from WHO, UNDP have discussed this. I've discussed this ad nauseum, have put together plans and things on how to respond to it. But unfortunately, we never learn. We do not read it. We think this is okay, it's done, and so we don't need to kind of look back and see what learnings it has offered us. So yes, unfortunately, we haven't learned from them.
So, Sohini, you've touched, in a big way and emphasized that this is as much a public health hazard as any pandemic is. There's a lot of black humor going around, which says that there'll be December and January babies. And there are some provisions in government systems have also been suspended, like the PCP Act.
Yes.
Right. What are your views on that? And also, if you could tell our audience what the suspension of this act means.
How I feel like I felt like a broken harmonium in the last few weeks. Going on talking about how the COVID-19 is disproportionately impacting women disproportionately, and we'll see far-reaching effects from this. So for example, when all the healthcare service industry in the country is geared towards fighting the pandemic, the most, what shall I say, neglected things that you can see is women's health, women's reproductive and sexual health. Do you know that there are a huge number of pregnant migrant laborers in Delhi right now? And people are trying to see whether they can be put up in some place, like a hotel, which is now empty, or somewhere like that. Where are these women going to get service from? There are cases of pregnant women being turned out from hospitals across the country. there are cases in Gaya, not in Gaya, I'm forgetting the exact district in Bihar, where a woman in an isolation unit in a hospital was raped, and I think she died. So there are many of these incidents, but the thing is that the emphasis on other kind of health, the maternal health. In Ebola and Zika, there were even references to vaccines being delayed, children's vaccination suffering, maternal health suffering, maternal mortality going up. Yeah. So all of those are issues that you need to remember when you are dealing with something like that. I'm not talking about even the mindset or the behavior as of now. I'm just talking about purely from a health angle. What are the things that we should have managed, or we could be managing in cases or like that. Then, and so the other things that has come to our notice is that there are far-reaching effects on even public health workers' health, because there's a whole thing about lack of protective gear or sanitizers and things like that. But what happens to their own health concerns, which could be menstrual health concerns, hygiene concerns? Are enough menstrual health products reaching these places so that the women who are 24 hours or sometimes 7 days at a row in duty, are they getting access to all of those? So many of these issues are actually part of public health system and preparedness, and that the mind actually boggles if you really think about it.
So there is of course a lot of civil society effort in this, but in terms of structural response, let's say even now if the government realizes that something needs to be done, what would you imagine would be the right corrective steps apart from, say, police enforcement to make whatever remaining, because we still have a couple of weeks to go on this.
Right. And when we did the town hall a few weeks ago, I think 10th of April, we did a town hall where there were about 300 plus 300 plus participants to think about these issues. There were a number of recommendations that came up, and I'm going to talk a little bit about the recommendations and what they were. And these recommendations came from women's organizations across the country. Yeah. Number one was that there is a need for targeted messaging from some of the topmost levels of national government on the issue of domestic violence. Somebody said, can we request the PM to actually, when he does all the other announcements, to say something about this? So we are working with the UN Women to see if we can approach the Ministry of Women and Child Development so that they could, in terms, approach the PMO to see whether this can be possible, like a public broadcast, across television and radio, to saying that this is the kind of behavior which is not acceptable, right? Second of all, service providers working on cases of domestic violence needs to be recognized as essential services by both governments, by governments, so that they can be open 24/7, and they would be exempted from the lockdown measures, so that they could travel, they could go, and they could see what is happening. Yeah, NGOs have been asking for this, but again, it has not been yet done. Government missionaries like the One-Stop Center. There are government centers like the One-Stop Centers who are supposed to be providing support on domestic violence. They must be strengthened. They must be provided full support so that they have additional requirements like protective gears or safe transport, access to the survivors. These are the places that have been created to respond to domestic violence. If they are not able to, then what is kind of, stopping them back? There were other responses and other kind of demands, so that, there were demands that COVID-19 measures must be gender responsive. There have been, women's rights activists and organizations working the world over to kind of send letters to their governments, across China, India, China, Canada, US, France, everywhere, messages going out to governments that that COVID-19 measures must be gender responsive. So this incident of the woman dying in Gaya district, who faced sexual abuse in an isolation ward, it's symptomatic of how the COVID-19 response is missing a gender lens. Also, so see the Pune Zilla Parishad took that interesting step. Can the National Commission of Women, or can the the central government take steps to talk to their state governments so that whatever can happen at the state level can also happen? We've seen the governments in Kerala and I think in West Bengal also announce helplines for domestic violence, and they have put out advertisements. And this happened after the NCW spoke to the local, Women's Commission in West Bengal. Yeah. The relaxation of the PCP-NDT rule is a huge setback. So PCP-NDT is, where you are not allowed to check the sex of the unborn fetus across any, health centers, government and otherwise. So they said they will relax the PCP-NDT rules till April 30th. Not very clear why that has happened. Maybe they wanted the people who actually to focus on to the COVID-19 pandemic or what, it was not very clear. But if you relax these rules, in our country, sex ratios are already skewed. We know that even if this is a law, people, communities and doctors and nurses have developed their own systems of finding out sex of the child, and sex-selected abortions do happen in our country still. Yeah. In Haryana, where we've been working from 2013 on this issue, it's a huge sex-skewed state, though the numbers have been rising so far. So if you take that away for even 30 days or a month, can you imagine what kind of rampant sex-selective elimination that can happen, over this whole period of a month? So that's a huge kind of, concern. The other thing is shelter homes. In some countries, like in France, I read that the government has bought 20,000 nights across hotels so that women can be sheltered there. Yeah. We do not have, our shelter homes are not equipped to take in domestic violence survivors. They are not even also clear on what to do. One organization shared that a shelter home asked the NGO to confirm that woman was not a coronavirus carrier. How would the service provider know whether the woman is positive or not? They didn't know how to tackle the issue. Neither the NGO knew, nor did the shelter home know. So there has to be clear directives of about the shelter home. What can they do? How can they test? The other thing was the ASHA and the Anganwadi workers. They are overworked. They are in the forefronts of fighting this at many places. But can they be equipped to just pass out some information to the local level? They can just give a leaflet or just some numbers and say, this is what is happening. If this happens, just be on the watch or something like that. There are also protection officers. So the domestic violence law of which was amended in 2005 says that that there should be protection officers available even at the block level who would handle the domestic violence cases. The protection officers are all now doing COVID-19 services. So one of the demand was that they should be removed from these duties so that they can focus on what is their actual work, which is domestic violence, and which is also happening during these cases. So these are a number of the demands. And the other was that, can we put out messaging for men? And can then men's group actually put out messaging for other men's groups to talk about this? And the last but not least, which is close to our heart, is bystander intervention. So we know that women might not be able to make the complaint, but can you as a bystander keep your eyes and ears open so that if you hear something in your close neighborhood, you at least can let them know that you are there and you are hearing this, or you can pick up a phone and make a complaint. You can share the number with other people to make a complaint. So can we be on the alert for this? So these were some of the recommendations and some of the things that we thought we would bring to the table.
So, honey, you mentioned some of these structural responses. What
Mhm.
about the decentralized approach? What can we do at a community level, and also previously the work you've done with influencers, right?
Right, right,
Say, for example, with her recent movie at Thappad.
right,
What
right,
can we do as as bystanders, like you said, and influencers to
right,
make this
right.
more manageable?
Right. So, if you can manage to show the Bell Bajao video, it would be lovely to kind of, show it at this point of time. But just to give you a background to that, in 2008, just before 2008, we were working actually with women, training them on gender and all of these, and, domestic violence and all of that. And the women in the community spoke up and said, don't talk to us. We know this. Talk to our men. Yeah. And from that actually came this whole idea of what happened if we actually can talk to men. And the idea of Bell Bajao was born. So it was a call to action for men to stand up and intervene, or just create an interruption in domestic violence by a very simple act like ringing the bell. um, and it was, in some cases it was really actually ringing the bell, in some cases it was many other things. The campaign actually became viral, though there wasn't anything viral in those days, but it became viral. It reached out to 243 million people, thanks to a government partnership at that point of time. We trained protection officers, we trained other government officials on domestic violence and gender and sexuality and rights. We Bell Bajao became a kind of a metaphor for taking action. So there were actions from all over the country. There were incidents like young boys would gather together in a neighbor's house at 6 p.m. in every evening to watch television in her house so that the husband couldn't come home and beat the wife up. People would go and ask for chai patti, shakkar, just to kind of interrupt that violence. Because when you interrupt, at that precise moment, both the perpetrator and the abuser find some amount of traction to reorganize themselves or rethink. The woman can get away, or the woman can do something else. The man has some time to think. So that was a fabulous campaign. And we are working to kind of bring parts of that campaign back. We cannot ask people to go and ring the bell now because lockdown and all of those situations, we have to maintain physical distancing. But we could definitely ask them to ring a phone, call a number and all of that. So if you can show that
Yeah.
video for
Yes.
our
Let's
audience.
play. We'll play the video now.
हिम्मत कैसे हुई तुम्हारी? How dare you?
क्या किया मैंने?
क्या किया? इस सास से इस तरह से बात करती हो? What do you think of yourself?
मेरी क्या गलती है?
Shut up! Shut up! गलती अब मैं करता हूँ. झूठ बोलने की आदत पड़ गई है तुमको. Just because I don't say anything. तुमको बस एक ही भाषा समझ में आएगी. एक ही. एक और बार अगर ऐसा हुआ ना तो मैं
एक फोन कर सकता हूं? हेलो जी, हाँ, मैंने ही फोन किया था.
Bring domestic violence to a halt. Ring the bell.
So yeah, we just played it for our viewers. Sohini, it's such a fabulous and powerful campaign that's aged well and is still so relevant.
Thank you. Yeah, it is relevant. So as members of community, if we can be alert, if we are focused, that if there is anything that attracts your attention, you feel is not right, at least we can let the people know that we know that this is happening. We can ring pots and pans, we can ring the bell, we can bang on their door, or we can just make a phone call on. So somebody, I think about a week ago, in one of the WhatsApp groups, there's this young man from Surat who was saying that one of his friends or relatives is being beaten up, and he reached out to an entire group of people. And soon, there were, in my office group, in another WhatsApp group, there was calls coming from this young man saying, please do something for my friend. And I think somebody got in touch with one of the NGOs in Surat, and they went and they got the woman out. So, things happen. Things happen if people listen and if people are alert.
Because one of the things that people keep asking is, are there stories of any hope in all of this? Like, are people doing anything?
Yes, people are doing, and look at yourselves. I mean, I don't think you would have focused on an issue like domestic violence earlier on, but that there's a need, and there's a need for everybody to do something. So yes, there are reports like this. I wrote a feature on Reader's Digest, I think a couple of weeks ago, on the same thing. And the man who was doing this, helping me do the research and finding out about the research, spoke to one of my colleagues, and he said, oh my God, I have seen bell bajaus in 2008 or 9. And I actually went and bajao the bell at somebody's house where there was sounds of domestic violence coming. And I didn't know that there was a organization behind it. And I'm talking to that organization, 10 years after this. So we hear stories like this all the time. So that's what keeps us going. Otherwise, this is a losing battle.
I had a quick question, Sohini, which is based on the National Family Health Survey. The same data says that only 1% of women seek police help, and more importantly, at a mindset level, 52% women and 42% men justified, right, that the husband was right in beating. Where does this sort of mindset issue come from, right? And as a media communications professional and non-profit work, how do you make sense of it? What do we need to communicate, right, to the public at large to change this fundamental mindset?
Right. So, breakthrough works at changing norms, and norm is what actually rules the behaviors that you see in community, right? We are all part of some kind of norm or the other. India and the world itself, is ruled by patriarchy. So we feel that our statuses, and women feel that also, that our statuses are often in relationship to a man in our lives. So it was my father, I'm the daughter of a father, I'm the wife of another man, I'm the mother of a male child, what should I say? Luckily, I'm the mother of a male child. That would be my status in the. So when you are constantly, your status is being reinforced by a man in your life, then you also start believing that whatever that man is doing to you is actually the right thing to do. And because of the patriarchal notions, men consider women as their properties to do whatever they want to do with it. So if I have to, make sure that she makes tea the exactly right way every day for me, and if it hasn't happened for one day, I can actually, just verbally abuse her. Or, as you saw in Thappar, if I am upset with what's happening at my job, I have every right to take it upon my wife, Women say, ek thappad hi to maar diya, aur kya? They haven't done anything else, ek thappad hi to hai. So this is so steeped in our thinking, in the mindset of our country and its people, that patriarchy has been, has been legally, it has been accepted everywhere. So when we try and break the norms, you have to start from a young age. So we work with the age group of 11. We start at the age group of 11, actually. We work with a bunch of adolescents, with about 400,000 adolescents across 5 states in the northern area of the country, where we have a curriculum on gender equality, where we talk about equality, we talk about rights, we talk about agency, and we talk to both boys and girls, because we believe that if we don't talk to the boys, then we will not be able to actually change things for the girls. So, and we talk about, transforming yourself. So from 11 to 14, you learn about those rights. These are some of the things that you need to be aware of. From 15 to 18, then we take them a step further and say that if you have changed, if you have gone through this, realization, can you also influence, some of the conversations, or can you also talk about it? Can you also influence others to kind of learn about it? And for the 19 to 25 age group, we are actually seeing actions happening. So girls and boys take action. They influence others to take action. They ask others to join in this fight against gender inequality. And we believe that it is this generation of people, this whole breakthrough generation, who will actually make violence against women and girls unacceptable at some future point. Apparently, South Asia has 70 years to close the gender gap. So hopefully someday it will happen. And we use media a lot because media gives you that whole thing of not being confrontational, not being in your face, being entertaining, and putting it in a very subtle way to people that these things need to change.
Yeah, media is disarming.
Yes.
Sohini, across the country, as we hear stories of disarray, have you heard some stories of hope? Apart from, of course, men being put in quarantine centers.
Recently, I'm sorry, but I've heard enormous amounts of stories of hope by the way common people have reacted to this pandemic, and the way common people are actually, helping out in the relief, work. From my next door neighbor to my colleagues to people across the country have just jumped into this. From making food, phone calls to connect, service providers to ration shops, to really kind of going there and cooking for 500 people. You see, people are responding to it. But I also wonder how long, is this going to be? How long are we going to see the hopes and the stories of hope coming through? Of course, prior to the pandemic, from our field, from our project sites, we hear stories of hope all the time, and those are the ones which keep us going. I'm going to share one story which I really love with you all. So this is the story of Anjali, as young, now 19. When she enrolled with her in our program, she was, I think, about 16, 15 or 16. Anjali is a girl from a small village in UP called Kudamau. Kudamau means garbage dump. Because of the name, Anjali was a laughing stock in school. People used to say, "Oh, you've come from Kudamau. It's a Dalit village. It's a lower caste village." People from Kudamau would never get invited to public functions or weddings and things like that. There's a sense that people from Kudamau are out of the margins. They're living on fringes. So Anjali went through our program, which we call Taro Ki Toli, in her school for about 6-7 months. And then one day she sat up and she said, "Why should my village be called Kudamau?" Yeah. And she then went and then she find out how can you change the name of a village. She approached her sarpanch. She spoke to him. They put in a petition at the block development office saying that we want the name change from Kudamau to Sundar Nagari. And then, her children at the school took out rallies. They did wall writing saying, Sundar Nagari. And so now the petition is on at the block development office. People have already started calling Kudamau Sundar Nagari. There was a coverage. There was an article done by local journalists. There was a radio program on Anjali's life and on Anjali's work. And this year, on 8th March, she got the Bhumika Award. So these are stories that if you talk about gender and rights to young girls and boys, these are the kind of active citizenship that you see happening all across. So these are our hopes. These are people who would take the country forward in many ways, in the days to come.
So I want to ask you a question about people. So, women who are middle class would in some ways would be better off. But there are a large number of women in the informal economy. In fact, I think they form a greater proportion than men in the informal economy. And they're bearing the burden of this. What do you think will be the long-term impact on women from that strata of society, and what kind of challenges do you see emerging?
I will talk about both women and girls from that strata of society, because they are part of the kind of same demographic. See, we all know that there is going to be an economic downturn, right? There's going to be days, months, years, maybe of an economic recession, or whatever it is. I don't know the economic term for it, but there is going to be hardships all around. When an economic crunch happens, the people to get affected right in the beginning are young girls, because and we are already hearing girls from our project areas talking to our community developers and saying, "Mera shadi tay ho raha hai." Parents are talking about getting me married off. So there, anyway, parents don't value girls' education so much in rural areas. When they reach a certain age, and 15, 15, 16, I think about 49% of girls are out of school at that age group in our country. Girls get taken off school. So moment crisis hits a family, there goes the girl's education, there goes the girl's nutrition. Yeah. And there will be issues of marriages early enough, before 18. We have worked so hard over the last few years to bring down the rate of early marriage in India. It's come down to 23%. But now we are going to see a reverse of that. There are going to be marriages. The women in the unorganized sector have no social security. So they have nothing to really fall back upon. So no insurance, no health insurance, no PPF, no gratuity, nothing, So what do they fall upon? They go back to square zero, they go back to where they started from. So that's going to increase. I already have spoken about the increased domestic, chores, the increased, unpaid care work that women have to put up with. In our country, less and less women are joining the labor force anyway. There's a downward trend, it has come down to some 27%, from 49% 10 years ago. So it's a huge, huge thing. There's a lot of stigma already attached to women going out to work. And even in middle class families, you will hear stories about how, an IIM grad gave up her career because she wanted to be at home and be a good mother. Yeah. Sometimes it's of the women's volition, but many times there are pressures, to be a good mother, to make sure that children are brought up well, and you need a mother to be there because the father's job is much more important. From the Ebola and the Zika experiences, there are enough evidence to show two things. One is that girls who get off school at this point of time, who are 15, 16, find it very difficult to go back to school. Boys go back much faster. And second of all, women who leaves their jobs or gets laid off at this point of time also finds it very difficult to then get back to the workforce. Because there is prioritization at families, saying whose job is more important, and it is always the man's job which is more important. So, it would be easier for a man to go out looking for a job or go back to his job, which he has somehow kind of maintained. Women find it difficult to go back to their jobs. Women find it difficult to, find new jobs. So all of this is, all of these are reality. These have happened. This happened at the Great Depression. This happened during the Ebola and the Zika, and this is going to happen again. So yeah.
And what does based on this, what does Breakthrough's future programming look like? What is it that you're going to do in the wake of this new reality?
So see, our program doesn't really change all that much, because we were working to make sure that girls have agency, that girls complete at least secondary education, that girls delay the age of marriage. These were some of the things, and that they have enough agency to say no to violence. Yeah, these are going to become even more important over the next few years. We also the network of young people, building the confidence of the young people, making sure that they have agency to respond to this is going to be very, very important. That's all part of our work. We might have to resort to more technology. If physical distancing is going to become a reality, we might have to find other ways of doing this, but preventing violence against women and girls is going to be even more important in the coming years.
Sohini, we have a question that's come in from Sonali Gupta. She wants to just ask you, how do we ensure the safety of women and children in isolation at hospitals, particularly when there have been a few reported incidents of institutional abuse?
Yes, and I spoke about it, the incident that Gaya that happened. It's difficult, but there has to be intention of doing that. There has to be more women nurses around, or women, ward girls around, women attendants around for this. You have to make sure that women are kept in women's wards and men are kept in men's wards, and there is no isolation at any point of time. All of these have to be prioritized. All of these have to be thought through.
There is a lot of, suspension of healthcare has become very common. In Bhopal, the Bhopal Memorial Hospital has been converted into a COVID-19 hospital. So none of the gas tragedy victims can access that space anymore, which is so crucial for them. We see similar things. Do you see similar things about sexual and reproductive health across the country in suspension of healthcare?
Yes, we see we fear that this is going to happen. And again, I'm going to draw on the Ebola and the Zika experience, which showed that maternal mortality went up during this phase because there was no care or no attention given to these kind of issues. We even now, I spoke earlier in this conversation also about how women are being turned away, pregnant women are being turned away from hospitals, saying, we cannot treat you at this point of time. A colleague of ours who just gave birth to twins very happily and very safely, thankfully, was told that she has to be, even though the date was fixed, she had to have actually a COVID test done, and the test was sent to Mumbai and it came back a day later. So she had to wait for a whole day for her delivery to take place. So these are things that will happen, and it's already happening. If it's happening in affluent hospitals, I cannot imagine what is going to happen in small town government healthcare facilities.
So we are at the onset of summer, and water scarcities are going to, rise up. What impact do you see on menstrual hygiene given this situation?
Menstrual hygiene, open defecation, sanitation, all are under threat because as we know, gender-based violence and violence against women and girls happen a lot when they go out to defecate openly, and there might be need again for them to do that. So those things are something that to talk about. Menstrual health again. Menstrual health has received a lot of attention in the last few years, I would say. People are aware, and we are talking about it. Finally, we have broken the silence around menstrual health. Men are talking about it. But again, when attention goes towards a virus and a vaccine and a protective gear, even health workers in hospital might not have the adequate menstrual hygiene products that are necessary for their survival, and might not get access to the adequate menstrual hygiene products that's needed for them. So all of these are really up in the air as of now, and we don't know for sure, but past experiences have taught us that all of this suffers when there's a pandemic, when there's an epidemic. So you have to make provisions for them early enough.
Great. I think we're done for today. Thank you so much, Sohini, for joining us and for speaking with us on a wide range of subjects. Thank you, Signable, for providing the sign language translation. Thank you, Gaganpreet. We will see you again soon.